Thanks, Robin. Nice to be with you all today, and greetings from South Alabama and Mobile. And happy to talk to you a little bit about what are some of these strategies we can do while some of my patients are now currently languishing at home, waiting for their elective procedure, where it was elective a few weeks ago, and then as this time keeps going on, it's getting closer to urgent because patients are stuck in their chair, they're stuck in their house. You've got to worry about immobility issues. And I think all of us can relate right now with COVID that it seems our refrigerator door is much closer than it used to be. And there's too many things in there that we are being enticed by. And so, weight is becoming an issue. So I do want to give a little background. I do about 5,500 clinic visits a year and about 450 joint replacements a year, just for everybody to understand. I'm kind of a middle volume guy. I do partial knee, totally up. And I am a consultant with Flexion as well. And so there are a number of interventions that I'm using right now, and I'm almost all telemedicine right now. As Scott mentioned, it's become very quickly a big part of my practice, and it's a way to continue to engage my patients and discuss some new treatment options and continuing others. So specifically, some things I'm doing. As mentioned, weight loss is the first conversation. In South Alabama, we do have a few that are overweight. And I find that all too often they don't have a specific strategy. I've got a one-pager on a diet that I like that I hand to them. And a lot of times my telemedicine and clinic visits are feeling more and more like primary care visits, but it's important for them to be able to be candidates for surgery when this lifts. I mean, the last thing we want is elective surgeries are back on and they're coming back in for setting up their surgery, and all of a sudden they have a comorbidity that hasn't been managed properly during this time, and now we got a further delay that's not related to COVID anymore. So weight loss, smoking cessation obviously is a longer conversation. Anti-inflammatories, medicines are going to be included. Home exercise programs, I'm emailing exercises right now, but I'll tell you, I'm real excited, as Scott just mentioned, about virtual therapy. I think that a lot of us need some interaction on the other side to make sure those exercises are being done correctly, instead of a one-pager and maybe a few different things at home to try to do it on your own. As I explained, you get the phone starts ringing and you put your piece of paper down. But if the virtual therapy has you engaged, I think that's a great tool. Diabetes is an issue across the country, but certainly not lost here as well. And, in order to have surgery, your A1C needs to be 8.0 or below. And, when we're talking about treatment options, the extended release injections that we have now, as mentioned, are great. And when you're talking about managing their diabetes, I've had people in the past with traditional injections, traditional corticosteroid injections, and I've now raised their A1C. They come back to clinic and go, I've been doing my diet. I took that dadgum piece of paper you gave me and I've been following it. And how did my A1C go up? And so I don't want to be part of the problem. And so I'm real excited about, these extended release formulations that will maybe, it seem to be, by all the data, their glucose spike is less, the efficacy of treatment lasting 16 weeks, and I'm just not seeing any issues with side effects. So it's become a big part of my treatment plan for conservative treatment. Now, we're waiting 3 months after that injection to do surgery, and we want to make sure we're not risking anything on infections and keeping a hold of all the data. And lucky to have a very low infection rate below 0.5%, but we want to keep it that way, and so make sure that we're not contributing to the issues. So injections are fitting well, but this is also a great time for research. And Scott mentioned, I got journals that sit on my desk sometimes and aren't fully read. We need to be learning more about what the options are and what the data is that may be sitting in this journal next to me that I could be using to implement new strategies that I'm not currently doing. So I think that maybe diving into the data a little bit would help all of the surgeons out there to make sure we're all offering the most up-to-date things. So, I tell you, I really have had a great opportunity through telemedicine engaging my patients who've been canceled from surgery. I'd highly recommend getting them on your schedule and talking to them and expressing to them, listen, here's the situation. We don't know when we'll be back to surgery, but when we are, here's our plan. And here's what we want to be doing right now in between. And so it's a great way to continue that engagement to hope that some of that J&J number for next quarter is elevated as much as possible for me and for all the surgeons out there. It's to continue to engage those patients to know that we still care about you during this time. So kind of to summarize, I'm doing a whole host of things in the clinic, but 98% plus of my visits are virtual, still able to accomplish those things, and excited to when this thing is all past us.